Good morning, Pierre. I've actually come in to speak to you this morning about revitalising threads. And as you know, they are well established in Australia and New Zealand, and they have a proven procedure in giving a fresh, new, rejuvenated look. What's your opinion on them?
Indeed, I agree. They are a great tool for facial rejuvenation, what I call soft rejuvenation. They've been around for a while. This is probably, or indeed the best of the lot. There have been few generations. This is what I believe maybe the fourth or even the fifth generation, with a great tool that allows to smooth wrinkles and to reset the tissue that inevitably over time start to sag down and need a little bit of a revitalizing effect. I think that revitalizing thread are a great tool for this purpose.
Now, can you explain to us how these revitalizing threads work, and how long do you envisage them to last?
It's a clever idea with the threads, and they are surgical suture with barbs. And what they do is they engage the subcutaneous tissue and they pull them up. Everyone's dream. We've all stood in front of a mirror trying to pull the skin backwards with our fingers. Now we can have a more permanent solution by using this minimally invasive technique and allowing for the skin to remain pulled. It's not an excessive pull, it's a soft pull, just enough to keep the skin a little bit tighter and looking a little bit more youthful.
And for patients that are considering this procedure, would you actually say it's like a facelift?
I wouldn't say it's like a facelift. It's a debate whether it's a minimally invasive facelift or not. I do not agree with comparing it to a facelift. Indeed, the effect, the final effect is different, is softer, is more natural. I think the patients that are good candidates for a facelift may not be necessarily good candidates for thread lifts. So I pretty much keep the two procedures separate, and I would not even compare them. The thread lifts are perhaps more suited to a younger age group. They have certainly preventative effect as to decelerating the effects of aging.
And how long, if a patient was considering this procedure, how long would the procedure take?
The procedure in good hands depends on the number of threads and on the number of areas that are targeted. Normally, within an hour, on average, the procedure is completed. It involves some local anesthetic, mild oral sedation, and the actual deployment and setting of the threads would cover probably 20 to 30 minutes. So it's a very quick procedure.
Now, you have some brochures there.
Yes.
So patients can actually come and get some patient information from yourself.
Absolutely.
And possibly a consultation?
Absolutely. We offer consultations for thread lifting in particular. It's becoming very popular. People are familiar with the concept. It's in the States. It has been going on for many years. It's now a well-established procedure in Australia and New Zealand. And there's plenty of information on the website, that certainly we hold brochures here for the patient to take home, get their hand around it, and see some example of what it's like to have a thread lifting with some before and after photos as well.
Great. So people can actually come to the Skin Institute and get a consultation with yourself and talk about costings as well, because obviously there's a cost involved. So what sort of costing would a patient sort of involved? If you compare it with a facelift, it's a lot less expensive, isn't that right?
Absolutely. I think considering all the procedures in cosmetic surgery, this is probably the best in terms of cost effectiveness. The procedure for, say, a lower facelift, which is one of the most popular that we do here at the Skin Institute, would be around the $4,000 to $5,000, all included. Of course, it depends on the number of threads that are inserted, but on average, you should budget around that amount.
And for a patient also, I know patients do like to ask this question, is the expected recovery time with threads? What's your experience there?
With the threads used to be advertised as a lunchtime procedure. I discourage anyone to think that threads would set within a few hours and give you the ability to just resume your daily activities within that shorter period of time. Indeed, I could say 24 hours is enough to recover from the initial swelling. There could be some bruising possibly, but that takes just a few days to recover. I normally tell my patient to cancel all of their social events for about a week. The actual recovery time, it's 24 hours, unless you're involved in strenuous activities, which you again would leave for 7 days. I think that you can resume pretty much your daily routine within 24 hours, and then don't be involved in social gatherings for about a week, because you may be uncomfortable. It can be a little bit of dimpling, a little bit of pulling, all of which will resolve within this.
So be sensible, really.
Absolutely.
Yes. Now, I have heard, a little bird told me that the revitalizing threads are a little bit different, and the results are remarkable because they are different now to what they used to be many years ago. So have you got anything to tell us about that?
Absolutely. The threads are a new generation threads. They are surgical threads with cogs. The simple idea has been redesigned, re-engineered, just to make the most of it. And making the most of it is that durability, safety, and ease of use. Promoitalia has devised threads that have got a double cog, that the amount of cogs is closer together. The thread is resilient and supple at the same time. So I believe that in terms of design and engineering, we are standing sort of in the best place we could possibly be in terms of evolution of the thread lifting. So the revitalizing threads do have an advantage over the previous designs.
Look, I really thank you for your time today. And have you got anything else to just let your patients know, or let people know that they actually can come in, have a consultation, and at ease just discuss the revitalizing thread lift with yourself, because you are the expert?
Well, absolutely. My advice to the patient is that to have reasonable expectation, and these expectations can be set properly during the consultation. Consultation time is the most important part of the whole interaction. The procedure itself is very easy, is very quick. It's a very low rate of side effects. So I believe that the patients should come in, have a chat, and see if they're a suitable candidate, because to me that is the best possible selection criteria in order to set expectation right and then get the best outcome out of the procedure.
Thank you so much for your time today, Pierre. It's been wonderful speaking to you.
Great to speak to you.